much, Laskin and Corla. Minister, you will be aware by now of the proposal to reconfigure the out-of-hours GP services in the Mid-West region, known as Shannon Doc. It will affect services in West and North Clare and the closure of services in Killaloe. Minister, this is unacceptable, it's short-sighted, and in my view it's a betrayal of the people who live in rural areas. The areas under threat by this reduction in East and West Clare are already some of the most isolated in terms of healthcare, not just in the County Clare, but throughout the country. A failure to intervene in this issue will be yet another example, I believe, of the government's turning its back on people from rural parts of our country. Someone in a rural area should expect to be able to access the same health services as someone living in towns and cities, and in particular those who have access to those services. The out-of-hours Shannon Doc scheme, in my view, has worked very well in treating patients in their community, and an attempt to undermine the availability of access to Shannon Doc services of rural communities will undoubtedly lead to delayed diagnosis and greater pressure being placed on the already under pressure and overstretched emergency department at Limerick University Hospital. In my view, Minister, the HSE and local doctors need to sit down and thrash out the problem and find a solution other than the one that's proposed. I don't accept for a minute that a small reduction in the number of doctors participating in the scheme is enough to require the drastic closure of the service in West and North Clare and in the East Clare area around Killaloe. Neither do I accept that the number of patients that are attending these services in some way don't justify the continuation or the existence of the current service. Minister, I appeal to you to go back to your department, talk with your officials, put in place a forum with the GPs and with all interested parties to sit down and find a solution to this problem. It's not enough to go back and say to the people in these areas, there aren't enough doctors, there's not enough people using the service, so therefore we're going to pull you all into the one area. Minister, if I could read for you a report that was recently aired on the local radio station Clare FM, and it refers to a Clare mother who has a 3-year-old who suffers from severe asthma on a regular basis. And recently, on a Sunday night, the child had an attack. They rushed to the out-of-hours GP service in Kilrush, and the child was successfully treated with a strong dose of nebulisers. Now, this is a regular requirement by the nature of what happens with young children. It's a regular occurrence for this mother. And she is deeply concerned if such an event was to arise again, such an event in the life or the health of her child. And she absolutely believes that she wouldn't have time to get to Ennis or perhaps Milltown Malbay, which is now the proposal. And therefore the closure in Kilrush has the potential to impact in a very negative way on just that family. The same in Ennis Diamond and the same in Killaloe, for a variety of reasons. And this service is funded by the state, and this model was put in place to take pressure and do away with the necessity of people to present unnecessarily in our accident and emergency units. And that's something that we all talk about and that we all need to see happen. And what we're doing now, in my view, is attempting to solve a problem that doesn't exist, and ultimately it will drive more people into our A&E services at a time when they're overstretched, overburdened and unable to cater and cope with the demand. Minister, I appeal to you to put the thinking caps on within the department and let some level of sanity prevail.
I want to thank Deputy Dooley for raising this important issue, and I can hear the anxiety which he is conveying here on behalf of his constituents, which indeed would be replicated by any of us in circumstances such as this. And I want to inform you that, as you know, GPs are contracted under the General Medical Services Scheme must make suitable arrangements to enable contact to be made with them or a locum or deputy for emergencies outside of normal practice hours. While there is no obligation on GPs to participate in GP out-of-hours cooperatives as a means of meeting the contractual requirement, Such services have been developed and expanded over time and are now an essential part of our primary care services. This helps to ensure that, to the greatest extent possible, urgent care needs are met in the primary care setting. As you know, in the Midwest region, the out-of-hours arrangements are discharged through Shannon Doc, a not-for-profit GP cooperative which is funded by the HSE. Shannon Doc has recently announced that, due to a difficulty in attracting GPs and in particular locum cover, it is no longer able to maintain its existing service across all of its centres. Following discussions with Shannon Doc in order to ensure the sustainability of the service, the HSE accepted a proposal from the cooperative to changes in the provision of the service. The most significant changes relate to the part of East and West Clare, essentially affecting Ennistimon, Kilrush and Killaloe, with minor changes in terms of operating hours in 2 locations in North Tipperary. The Government is committed to ensuring that patients throughout the country continue to have access to GP services, especially in remote rural areas and also in certain disadvantaged urban areas, and that general practice is sustainable in such areas into the future. It is imperative that existing GP services in these areas are retained and that general practice remains an attractive career option. The development of primary care is central to the Government's objective to deliver a high-quality, integrated and cost-effective healthcare system. The Programme for Partnership Government commits to a decisive shift within the health service towards primary care in order to deliver better care closer to home in communities across the country. The programme emphasises the need and focuses on enhancing primary healthcare services, including the building up of GP capacity, increasing the number of therapists and other health professionals in primary care, continuing to expand the development of primary care centres and facilities. The annual GP training intake has increased from 120 prior to 2010 to 172 this year, and I know that Minister Harris is anxious to achieve further increases in future years. The Minister has emphasised the need for a new GP services contract which will help modernise our health service and develop a strengthened primary care sector, and health service management have already progressed a number of significant measures through engagement with GP representatives. The GP contracts review process will, among other things, seek to introduce further measures aimed at making general practice a fulfilling and rewarding career option into the future. Progress to date includes changes to the entry provisions into the GMS scheme to accommodate flexible or shared GMS-GP contracts, and an enhanced support package for rural GPs, which includes a change in the qualifying criteria for rural supports and an increase in the financial allowance from €16,216 to €20,000. The recent changes to the Shannon Doc out-of-hours service will be subject to a 3-monthly review, and the impact will be closely monitored and evaluated by the Health Service Executive. And I hope you find this information helpful, Deputy.
Dooley.
The Minister is here on behalf of the Minister for Health, and I think you have been as frank as you can. And you've really touched on the nub of the issue, and you've talked about a GP's contract. Whilst it's contracted service, and GPs under that contract must provide suitable arrangements to deal with the out-of-hours service. In my view, Minister, and in the views of many people in the constituency that I represent, the solution that has been arrived at is not a suitable arrangement. It's not fit for purpose, it does not meet the needs of the community, it does not ensure a safe outcome for patients who encounter issues, like I have already pointed out to you. It will undoubtedly delay some patients getting access to treatment which is essential to save their lives in some circumstances, and in others it will delay people presenting to the medical system, which will invariably mean that they'll end up in an A&E and will require a hospital stay as a result of a delay in getting to the doctor in the first instance. And that's going to put more glue in the cogs of the health system in the Midwest. And I would appeal to you to go back to the department and try and see if the HSE would reject the proposal that has come forward from the doctors. I was taken aback to discover that the HSE have accepted the proposal presented by the doctors, because if they were to put in place the appropriate checks and balance and took the interests of the patients who the doctors and themselves are supposed to serve then there is no way that they could have accepted that proposal. In my view, they should have gone back to the GPs and the people who run this service and said, no, it's not acceptable, it doesn't meet the needs, it's not a suitable arrangement, and that you must put in place and work with them to find a suitable solution. So I appeal to you, Minister, to go back to the HSE, re-engage with the doctors and try and ensure that we have a system that's fit for purpose, meets the needs of the patients and ensures that we don't further clog up the A&Es that are under such enormous pressure at the moment.
Can I reassure Deputy Dooley that I will certainly convey your very strong and articulate feelings on the matter to the Minister and to the Health Service Executive. And I suppose the challenge that Shannon Doc have, as I'm advised by the Health Service Executive, is that it is due to a shortage of doctors that they are in this predicament. And because of this, they just cannot maintain the services. Now, what I've been told is that the Killaloe service will be open during the weekdays on a needs basis, with a mobile doctor servicing the centre. At weekends, the operating hours will change from 9 a.m. to 9 p.m. to 2 p.m. to 6 p.m, with patients being seen at Limerick, Ennis and Nina centres outside of those hours. The Kilrush Ennis Diamond service will relocate to Milltown Malbay during the weekdays, with the same operating hours applying, and both centres will be operational on Saturday and Sunday up to 7 p.m. instead of up to 9 p.m. And I know that's not what you want to hear, Deputy, but I'm afraid that's the way things are just at present. I'm further advised that the HSE grants Shannon Doc to assist in its operations at grant aids, and the changes decided by Shannon Doc aren't influenced by a funding availability provided by the Health Service Executive. So can I just assure you that I will certainly convey the disquiet of yourself and indeed your constituents about this issue to the Minister and to the Health Service Executive, and see if there can be further efforts made to ensure that the type of services that people were used to, and as articulated by you in that particular case, that those type of services can be provided to your constituents as they are so used to having it.